this figure, 7.6 million people were waiting to start treatment at the end of June. We're talking about the National Health Service, of course. Record numbers. So it was 7.5 million in May, and now it's 7.6. The highest number since record began in August 2007. So let's talk to Tony O'Sullivan, co-chair of Keep Our NHS Public and a retired consultant paediatrician. Tony, when I run that number by you, 7.6 million people and presumably rising, what do you say?
Well, I hear it with horror because that's 7.6 million people worried about what's going to happen to them, in discomfort, in pain, anxiety about untreated potential cancer, and it's unacceptable, just unacceptable.
It might be unacceptable, but it is the reality. And the doctors are very clear. They regret this, but they're going on strike because they're concerned not just about their salaries, but about their service. That's the junior doctors. Then the consultants, of which you were you were a consultant paediatrician, were you not? And then we've resolved, we think, the nurses' issue by default, and the paramedics, etc. Although the radiographers, I think they were striking at 1.2. One wonders how we at least begin to talk about a resolution to this, because at the moment there is no sign of one anywhere, is there?
Well, we have to say, we have to look for a political solution. The reason so many hundreds of thousands of NHS staff have been forced to go on strike isn't because they're callous, it's because they care about their patients, they care about the NHS as a service, and they care about themselves and their colleagues' future in the NHS. And the government, unfortunately, has had an attitude to public service and the NHS in particular over the last 13 years, which has seen it fall off the top table as the best health service amongst the developed economies of the world to falling right down and having such a disastrous level of letting people down. And I say it's the government is letting the NHS and the population down. It isn't the NHS that's letting the people down.
As someone who believes passionately in the ethos, the mission of the National Health Service, how worried are you that as people get more and more disgruntled, they might point the finger at the entity itself and say, this doesn't work anymore, and we have to bring in more private practitioners. We have to diversify because the current model is unsustainable. There are lots of people on the right who feel this, but how concerned are you that lots of people in the centre will conclude this too? Because it's so bad.
It's a really important issue, and I'm very grateful that you are raising it and raising it in the way that you do, which is actually looking for the truth in the matter. The thing is, we know what works. The NHS, when it's funded properly, has been the best model in the world, and it has met the needs of the population even when they were growing. The waiting lists for assessment and treatment were less than 18 weeks in over 90% of the cases, and A&E was a smooth-running operation with 95% treated and sorted out, either admitted or sent home within 4 hours. And that was in 2010. It was still actually functioning pretty well until 2015, despite 5 years of underfunding. And since then, another 8 years, the wheels are coming off. And what heartens me is that the vast majority of the NHS, the vast majority of the population, when polled, are still completely behind the NHS as a delivery of service model where the population share the cost of that through their taxation. They're behind that model very, very firmly. 70% of Conservative voters, when polled, blame the government for the crisis in the NHS, not the NHS itself. And the vast majority of people regard the diversion of NHS funding to the private sector as the wrong strategy. So it's important that we get the messages out there that we know what works. When it's funded well, you can drive any service, any enterprise into a failure if you starve it of funds.
Okay. Tony, thank you very much indeed for joining us this evening. That's Tony O'Sullivan, co-chair of Keep Our NHS Public. This is Henry Bonsu on time.